Hello viewers, welcome to Health Commune. Health Commune is a health literacy platform where we try to bring about right medical information from the right experts simplified for you. I'm Dr. Kavyashree, host for today's episode. So our topic today is very common yet overlooked sometimes, that is diabetes. Despite how widespread it is, people are still unaware on how to effectively manage it and prevent its complications. So today's episode we have with us Dr. Srihari Kulkarni, who will be discussing in detail about diabetes, its management and preventions. Hello, doctor. Welcome to Health Commune.
Thank you, Dr. Kavya.
So, before we get into the episode, could you please give us some information about you? Where do you stay? Where do you work?
Sure, I'll be happy to. So, hi, I'm Dr. Srihari Kulkarni. I'm a consultant physician and a diabetologist, and I work in Bangalore. I have my own private practice, and I'm also a consultant physician in a multi-specialty hospital in Bangalore, in north side of Bangalore. And yeah, so my special interest is in diabetology and metabolic health. So that includes your obesity, the dyslipidemias, that is all your cholesterols and all the other things which are related to your metabolic health. So I do work in Bangalore, so I've always been in Bangalore. That's all there is.
Yeah. So, there's this article that mentioned that Indians developed diabetes 10 years earlier compared to the people in West. So, what could be the possible reason? Like, because at this point, we can't just say it's just the lifestyle.
Very valid point, Dr. Kavya. So, before we look at the articles that have told you that we developed diabetes a decade earlier compared to the general population, as we call it, okay? The Asians, not only Indians, the Asians in general have that. Now, there could have been a time when you could have attributed that to the lifestyle of Indians, but it's not just the lifestyle of Indians, okay? We'll come to that. So, before we look at the lifestyle itself, we need to understand that the Asian population is quite different from the global population. So, whatever studies we look at when it comes to the guidelines that we have, for example, for management of diabetes or management of obesity for that matter, or even the BMI cutoff guidelines, there are clear understanding, and at least it's evolving and it's becoming much more clearer these days that Asian population is quite different from the global population. Okay, from when you look at the entire world as a unit. So why is this happening? Yes, definitely there is a little bit of lifestyle component to it, but you need to understand that there is also a genetic component to it. Okay. So the Indian as well as the Southeast Asian, the South Asian population particularly is more prone to add on more of fat in their body, okay, with the same amount of calorie consumption. I'm giving you the example of, let's say there's somebody from Caucasian population or Mediterranean population, they are having the same bowl of rice compared to the South Asian, you're having the same bowl of rice. The way your body handles it is very different from the way the body handles it in that population. That's how we are built. That's the first thing. The second thing is, if you look at the diet the Indian population or even the Asian population has, you realize that we have more carbohydrate rich meals compared to the Western world. Okay, where in the Western world it is more of a protein rich meal that you see. Okay, we'll come to that. We'll come to why that happens. But these are the important ones. The other important thing that we need to understand is, if you imagine a typical Indian, let's say in the age of 40s, what you would imagine is a very lean individual, a very thin kind of hands and very thin legs, but a very big belly, right? So that central obesity, as we call it, is one of the important markers of why we develop, sort of insulin resistance and diabetes very early in the lifetime. And that happens because when you develop central obesity, the insulin resistance plays a very important role, which also is signaling to the body that you're not handling the glucose the right way. You have to handle it in a different way, and that is how your body develops diabetes. So, which is one of the reasons why we develop diabetes much much earlier compared to the Western population, or when you look at the entire world.
That explains people getting that early 30s. Yeah, maybe the lifestyle there. It early ages. Also, when someone says that they have diabetes, they think their blood sugar levels are high, maybe they should take medication. Or how is it different in different types of diabetes? We have type 1 diabetes, type 2, and gestation. What exactly is the mechanism and how are they different?
So let me break it down what diabetes is for you. Okay. So if you put diabetes into simple terms for people to understand, it's basically a body's state. I wouldn't call it a disease at this point, but it's a body's state where your body is having excessive glucose as a result of certain pathological mechanisms within the body. Okay. Now, what is pathology? Pathology is where something is off balance, meaning your body is not in the right balance. It's going somewhere else. It's straying towards some other path. So that is why it happens. Now, diabetes is that state. All right. So, as you mentioned, there are different types of diabetes. Okay. And these are clear cut classifications of how body or how one develops these, high glucose levels. Okay. To break it down into simple terms, as you've mentioned, we have type 1 diabetes, we have type 2 diabetes. There's also a very hazy category called type 3 diabetes also. We'll not go there right now. And then you have your gestational diabetes. Gestational diabetes is basically where a woman in her pregnancy develops diabetes. Okay. See, now you need to understand that diabetes is a very dynamic disease. Okay. Very dynamic metabolic situation of the body rather. Okay. Now, type 1 diabetes, before we understand that, we need to understand what happens within the body. Okay. I'm making sure that even a simple person understands it, even a person without a medical knowledge understands it. So, you have your body, you have multiple organs within the body. You have your brain, you have your heart, you have your kidneys, you have your liver. These are the ones that people commonly know, right? So, similarly, there's an organ called pancreas in the body. Okay. So, it's somewhere in the left side, towards the left side of the body, where the pancreas produces something called insulin. Okay. So insulin, remember, in basic terminology, is just a chemical within the body. It's just a messenger within the body. That's all. It's going to tell, and it's going to tell certain cells within the body, do this kind of an action. Okay. It has multiple actions, but that's how it is. So in pancreas, there's a particular type of cell called beta cells. So you would have heard this word, beta cell depletion, beta cell overload, beta cell overactivity, these kind of things, right? So that is basically the factory of insulin. That's all. It's a very small component, very small structure within the body. So in type 1 diabetes, basically, the beta cells get destroyed. Okay. It's basically somebody is coming and destroying the factory, and then you will not have that particular product coming out of the factory, right? Similarly, in type 1 diabetes, when something destroys the beta cells, that's how the insulin becomes absent within the body. There's no production of insulin. Okay. Now, if the entire factory is shut down, there is zero insulin. If the half of the factory is shut down, then you might have a little bit of insulin coming out. Partial insulin secretion will be there. Okay. Now, how does this happen? There are multiple mechanisms which are hypothesized, but the one that is the strongest, the one that is the most accepted by the medical community, is something where the body destroys its own cells. It's like today, I'll say the army comes and bombards a particular city within the country itself. It's not against some other country, within the country itself, thinking that this is our enemy territory. Okay. So that is the disease process that happens in type 1 diabetes, where your body is fighting against its own beta cells and its own factory is being destroyed, where your insulin is stopped from producing, right? Whereas type 2 diabetes is a different kind of thing. Type 2 diabetes, I would want to say, it becomes more of a coolie worker. Okay. So, or I would want to call it a donkey kind of a situation. Okay. So type 2 diabetes is a very dynamic process. In type 1, we have structured approach. This is how the body is. This is how the body is destroying its own pancreatic beta cells and gone. In type 2 diabetes, it's a dynamic, very, very dynamic process. There are multiple factors: your genetic factor, your hormonal factors, your the diet factors, dietary factors, your exercise, your activity levels, your muscle mass. There are multiple factors because of which the way your body handles glucose is very different. Okay. So a person with type 2 diabetes versus a person with no type 2 diabetes, if you look at them and compare, that is how you understand type 2 diabetes, what type 2 diabetes is. Let's say they both have the same bowl of rice. Okay. A person with type 2 diabetes, because of various factors, produces more insulin, pushing the body hard to absorb the same amount of glucose. Whereas a person with no diabetes is requiring normal levels of insulin. When it comes to the gestational diabetes, it is more of a physiological diabetes, meaning the diabetes is not exactly because of a disease process happening. It's more of factors within the body which is changed throughout the pregnancy. Let's say, for example, you have something called human placental lactogen, or even for that matter, progesterone. These are the hormones produced within the body. These are chemical messengers. What is a hormone? It's basically a chemical messenger within the body which is produced, which tells the body that you have to handle glucose in a different way. You're handling it so far in this way, but you're not supposed to handle it this way. Please handle it this way. Okay. So because of which, what happens? There is a transient increase in a insulin resistance within the body. Transient is, it is a short lived, because post pregnancy Ideally it should come down, but it's also a marker that the person can develop diabetes in future, in the later part of their life also. But the way the body handles it is very different. So because of which there is excessive glucose within the body. Maternal hyperglycemia. What is glycemia? Glycemia is glucose. Hyper is hyper, increased. Okay. So because of that, there is hyperglycemia. Whatever the mother has goes to the baby also, right? Goes to the growing fetus, growing baby, because of which there is an increased blood glucose within the baby. But baby's pancreas is normal. Okay. Baby also has pancreas. It's not, pancreas is normal. It's producing insulin. So it's seeing a hike in the glucose. It's seeing, okay, there is more glucose coming. We are going to increase the insulin. When the body increases insulin, when the baby's insulin pancreas is working overload, it is increasing the insulin. It causes certain changes within the baby. The baby grows big. We call it macrosomia. Okay. And along with that, when the baby is born, the immediate cutoff in the glucose is there, but at the same time the signaling into the pancreas is not there. The pancreas still thinks I'm going to still get a lot of glucose, so I'm going to pump more insulin into the bloodstream, so the baby can develop something called post, or post delivery or neonatal hypoglycemia. What is hypoglycemia? That is low glucose. So these are complications that we see. There are many other complications, but I'm just streamlining it and telling you that what is the the bare bones of what happens with GDM, that is your gestational diabetes. Yeah. So these are how the diabetes is classified.
Good.
Yeah.
So when we talk about gestational diabetes, recently I've seen a friend of mine having this very say diabetic mother, and like you said, the baby has hypoglycemia, and the parents and their parents, everybody got confused. Like mother has diabetes, now the baby is going to have diabetes, but it's exactly the opposite thing happening there. Yeah, that explains everything. Why the baby is having the best blood sugar levels.
True. So you should always understand the disease process, so it's easier for you to understand what to do for that.
Correct. So you mentioned earlier insulin resistance, the word term. So what exactly is it? What is insulin resistance and what is happening there?
Okay. Yeah. So that's also a very upcoming topic. We are seeing so many people talking about insulin resistance in social media, and so many people are misinformed at times about insulin resistance and the information related to that. So before we break down insulin resistance, I have this approach where we have to take a step back and understand what insulin is, what resistance is, and how it develops. Okay, that's how you get to know. So we'll come to insulin resistance in a second, but before that, for now we have understood that insulin is, yes, we've understood where insulin is from. Okay, see, insulin is basically a chemical messenger. Why is it produced? For your simple understanding, it is produced when you have glucose within the blood. You have food. For example, we take rice. Indians love rice, or even rotis, chapatis. Everything contains carbohydrates. Okay. Okay, so now carbohydrates, there are two types. One is something called complex carbohydrates. One is something called simple carbohydrates. Very simple. Complex is something that is difficult to understand, correct? Simple is something that is very simple for you.
Simple.
Similarly, complex carbohydrate is something that body finds difficult to break down. Simple carbohydrate is where the carbohydrate is very simple. Okay, it is very easy for me to consume and it will immediately give me a good high. So now, if you want a very simple understanding of what this is, whatever foods make you feel sleepy after you have it are simple carbohydrates. Okay. So as soon as you have food, let's say you have a full pot full of biryani, okay, and then you will sleep nicely for 4 5 hours. Why does it happen? Because your body wants to take rest while the energy that is coming from the food that you have had is being absorbed and sent to the right places. As soon as you have food, takes rest so that the body focuses on digesting it and focuses on distributing the energy into wherever it is required, right? So now you have the rice. Rice is a very simple carbohydrate. Food, whatever you have, which is making you feel sleepy, is simple carbohydrate for you. That is easier for the body to understand. You have a spoonful of sugar or you have a bowl full of ice cream. You will feel sleepy after half an hour to 1 hour. Why? Because it's very simple carbohydrate, right? So now when carbohydrate is being absorbed into the body, the simplest form of carbohydrate is glucose. For simple understanding, but glucose is one of the simplest form of sugars within the body. Okay. So your body absorbs the glucose, okay, through various mechanisms. There are certain transporters, as we call it. They are basically gates. You have gate within the quarters where all the people come in. We have gate within the factory where all the people come in, right? So like similarly, there are certain transporters, as we call it in medical terminology. They are just gates basically. They open and the glucose enters into the bloodstream directly. Bloodstream is where your blood is. Okay, so that is where it enters. Now once it enters the blood, your pancreas also is being supplied with the same blood, correct? So your pancreas detects that there is an increase in the glucose. Your body signals that okay, now we have a surplus, or we have a lot of energy. Glucose is basically energy. Okay, it again breaks down into certain other components. We'll not go there, but yeah, so it's basically energy. So it body says okay, we've got excessive energy now. We have to store them somewhere, correct? So how does it store? It needs some signal to store, correct? So who tells that there is high energy? Insulin is going to tell that there is high energy, that is high amount of glucose within the body. So insulin is being produced as a response to high glucose, right? So when the insulin is being produced because of as a response to high glucose, there are certain places which identify, yes, this is correct, this is a legit response from the body, okay, there is a increased glucose right now. Okay, so now what are those places? There are two important places that we need to understand, three important, but we'll boil it down to just two. One is a muscle, the second is a fat. Okay, what is fat? Fat is basically accumulation of certain small cells, like how you have brain cells called neurons. Okay, like how you have cardiomyocytes in heart. There is something called hepatocyte within the liver, like how you have skin cells. Similarly, fat is also an accumulation of certain cells, and the cells are called adipocytes. So now these are again cells, and your muscle are the different kind of cells. These are the two important cells which handle the energy, because for you to move around you need energy, right? And for you to move around you need muscles which move. So in muscles it is stored as something called glycogen. This is the storage form within the muscles. And then you have fats. So when the body produces insulin, when pancreas produces insulin in response to very high glucose, the muscle stores some amount of the glucose as glycogen. But if you're having excess rice or excess simple carbohydrates for that matter, not only rice, any simple carbohydrate for that matter, your body is having excess glucose, which is in excess of what is stored as glycogen within your muscle. So what happens to the remaining part? Remaining part has to go somewhere and get stored, right? So it get converted into something called fat within the body and get stored into these adipocytes. Okay, and then the fat increases. Okay, I'll tell you a very a mind blowing concept here. When people gain their weight and lose their weight, people lost 10 kgs, I've lost 15 kgs. In reality, the number of cells, the number of fat cells are still the same. It is just whatever is within the cell that is shrinking. A cell which was this big, yes, the cell which was this big is becoming smaller. It is not that the cell is going and dying and going somewhere. New cells are not being formed there. It is the same cell which is growing and shrinking. There are certain other changes also that happen, but this is what happens, which is why it is difficult to lose weight. That's a different concept altogether. Okay, now we'll come back to the insulin part, right? So now you are storing a lot of fat within your body. Okay, you're storing so much fat. Now there comes a point in the body where you're having constant food every single day you're having excessive carbohydrates. You're not moving around. Your glycogen. See, when you move around, your muscles move, muscles utilize the energy, your glycogen gets depleted and it gets replaced again, correct? So you're not moving around, you're still having same food. It's like going to grocery store buying 25 kg rice bag every single day. You're buying it every single day. Where will you store? You store it in your storage room, wherever you have it, correct? So what do? You use some part of it for the energy that is required for your day-to-day activities, and the remaining part is being stored. So because of that, your body starts developing a lot of fat. Okay, and in Indians and in South Asians, the fat is stored primarily within our central area. We call it central obesity. Now what happens as a consequence of this? You might be saying, "Hey, it's a good thing to have storage, no? It is nice, it's a good survival mechanism." But what happens because of that is your adipocytes, that is why I told you the word adipocytes. Adipocytes have certain chemical messengers which come from them also. Okay, it's like your storage room has a warden who says, "Bhai, bahut zyada ho gaya. There is a lot of food right now. Please stop it. Exactly. Please stop it." So then body says, "Yeah, okay, fine." The house people say, "Okay, okay, we'll stop bringing 25 kg bag of rice every day." But what do? You start eating, consuming because of various other mechanisms within your brain. That is your craving mechanism for food, your appetite increasing mechanism. There are so many other things. But because of this, your adipocytes or your fat cells are under constant stress. It has to store the fat all the time, right? So because of this, there are certain mechanisms which happen within the body which fight against the body itself. We call it inflammation. You would have heard about this term quite frequently in social media. What is inflammation? We've seen so many people talking about inflammation, but what inflammation basically is that your body is fighting against some sort of a stress. That's all. whether it is physical stress, whether it is psychological stress, whether it is some other chemical form of stress, whatever it is, body is fighting against it. To put it in simple terms, inflammation is something that people ignore, and people tell, okay, take anti-inflammatory diets, this, that, and all, but that is not how inflammation works. Okay, it's quite funny to see people talk about it on social media like it's a cup of chai, you have it and you finish it, right? That's not how inflammation works. But because of this, your body is going into a higher inflammatory state. It's going into a pro-inflammatory state. Okay, there is pro-inflammatory, there is anti-inflammatory. Pro-inflammatory state. Now, because of the pro-inflammatory state, your body's signals of insulin is not being understood by the body. Okay, there is a lot of chaos happening within your fat cells, within your muscles, that अरे क्या हो रहा है? There is insulin coming, but I'm not able to understand it. Okay, it goes into that midlife crisis where I am not understanding what to do. So it goes into its own spree. It starts accumulating more. So it's a vicious cycle that happens where your body develops the resistance, where your body goes into more chaos. And because of the chaos, your body is accumulating more fat. And because of the fat, your body is again going into deeper chaos. So because of this, your body goes into a phase where whatever glucose is there is giving a response for insulin, but the insulin messenger is not being deciphered or decoded properly by the body cells, because of which the insulin is thinking I am not doing my job right, I should push more. Or pancreas is thinking I'm not doing my job right, I'm not, even though I'm producing insulin, I'm not able to reduce the glucose in the body. Okay, because of which it produces more insulin, because of which the fat cells accumulate more, fat within it, and then becomes more and more. Okay, so this is the concept of insulin resistance, where your body becomes less sensitive towards insulin in handling glucose, and that is where the problem occurs.
Yeah, got it. So, how do we identify people with insulin resistance? Is it just the blood test? Or
See, yeah, that's also something that people need to understand. Okay, so how do you address, or how do you assess rather, insulin resistance? See, there are various markers for you in the studies which have shown that, okay, if you have this, your insulin resistance is high. There are certain ratios, as we call it. There is something called triglyceride HDL ratio. If the numbers are less than 2, it is good; more than 5 is bad. You have certain markers, something called HSCRP, if you've heard about it. There's something called high sensitivity C-reactive protein, which is increased in people with certain inflammatory states, which is again attributed to, yes, again, of course, which is again attributed to your insulin resistance. But putting it into simple terms, you need to understand, if you are, it's very bare bones is what I'm saying from my clinical understanding, from what we have seen. If you have a belly, if you have a belly fat, you are insulin resistant at some point. That's there. Okay, it's as simple as that. So according to that definition, 99% of India is insulin resistant, because everyone has some or the other belly, correct, belly fat. But if you want to go to the specifics of it, if there is somebody who wants to know a little more, okay, I'll tell you, there are few important markers we look at. Okay, one is something called body mass index. Okay, body mass index is very simple. It's something, yes, of course, BMI. It's very simple. You just calculate your weight in kg, and you divide it by your height in meters squared. Okay. So let's say you are 70 kg, 71, 70, 72 kg, example, and you have a height of around 165 or 170 centimeters. It would be 1.7 meters. So you square it and you calculate that. That is your BMI. Based on this, there is a classification. Again, it's not the only method available. It's one of the methods which are easily practicable by everyone. So you know your height, you know your weight, it's easy to calculate. It just gives us a ballpark of where the person is. Okay, there are various factors because of which the BMI can be high. Somebody with a very high muscle mass, somebody who's a good bodybuilder, can also be having the same higher BMI as compared to somebody who's a very fat individual also. Okay, that's one thing. The second thing that we look at, that is much more specific, is something called waist hip ratio. Okay, then you have something called waist circumference, where you look at the waist circumference, and if somebody's circumference is above 90 in men, above 90 centimeters, and above 80 centimeters in women, you are likely to have a insulin resistance. Then there is also something called acanthosis nigricans. That's a medical terminology. To put it into simple terms, people can have certain hyperpigmentation. That is a little blackening of skin, particularly in the back of the neck, in the lower back, of course, of course. Then there can be things like skin tags, which you see within the body. Skin tags are basically skin propping out, and you will be seeing them like tags. These are markers of insulin resistance. Okay, so if you tell, is it a formal diagnosis that somebody is insulin resistant? Definitely not. That's not a formal diagnosis that you call somebody insulin resistant. You call somebody diabetic. There is formal diagnosis called diabetes, but there is no formal diagnosis called insulin resistance. It's more of a dynamic state. So you and I can be insulin resistant, but I can be more insulin resistant than you. It's more of a spectrum of the resistance rather than yes or no. It's not a two-dimensional. It's not a black and white phenomena. It's more of that there are lots of shades of gray within your insulin resistance also. So these are the markers that we look at. Another one called HOMA IR. That's again, it's a very complex understanding. That's something that you need to understand only if you're going to a doctor to meet the doctor, and for guidance regarding HOMA IR or for guidance regarding your insulin resistance, then that is where we calculate those things.
Okay, let's come back to diabetes again. Like, what are the early symptoms that anybody has to pay attention to? And we see some people just simply ignore it. So, what are the symptoms basically?
Yes. Okay. So usually diabetes is diagnosed in a very late stage. Okay. If you see how diabetes is diagnosed, most of the times usually people come with either urinary tract infection, one thing, or people come with unexplained weight loss. People would be losing too much of weight, or people would be having too much of weight gain. Okay, there will be unexplained weight gain also. These are the reasons why they come. There are certain conditions where it is already too late, where people come to you with certain neuropathies. What is neuropathy? Neuropathy is basically where a nerve is damaged because of some reason, because of some disease process, a nerve is damaged. So it is called neuropathy. So where people come with complaints of a little bit of tingling or numbness sensations within their soles or feet. They experience that that something is off and it bothers them in the night. They're not able to sleep properly. Sometimes even rarer phenomena where people develop heart diseases, people develop heart attacks, because of which they come with diabetes. Sometimes we also see people coming with diabetes when they have higher cholesterol as a consequence of diabetes and uncontrolled diabetes, things like this. Sometimes people with kidney disease come. Sometimes people with wound infections within their leg come. This is where it is too late, almost too late, where you're going to do more of a damage control rather than just bring it back to normal levels, because you're just you're treating the you're making sure the complication that has already happened is not going to progress further. You're just improving the quality of life there. That's all. You're not addressing the actual issue there to the extent that you address it in the earlier stages. Now when you look at the earliest symptoms of diabetes or insulin resistance or even pre-diabetes for that matter, there are certain key parameters that we look at. So one thing that is very clearly being understood right now is easy, people feeling very weak easily. Okay. Extreme tiredness weekly, feeling very weak easily. When they have food, they feel extremely sleepy. They feel extremely sleepy. Lack of energy that they experience. Then a sudden increase in the fat within their abdominal region, which I told you is why, because of a feedback loop that happens, because of the insulin being produced, because of the body storing fat, storing a lot of fat and all of that. Right? Then people develop, as I told you, the acanthosis nigricans, or a little bit of darkened patches on the back of the neck, skin tags, these kind of things. So this is where they develop. And the other symptoms would include increased frequency of waking up in the night just to pee. If somebody is waking up more times to pee, that could be an early indicator that yes, you are going into diabetes. Okay, your body is not handling glucose properly. Then people can feel extreme thirst also. Why does it happen? Because you're peeing a lot, so you're losing a lot of water in the body, so you're also feeling dehydrated also. Okay, so that can also be an earliest marker of diabetes there. So these are the things which people miss and people ignore as something else, and they would attribute it to something else. Let's say they would attribute it to summer and think that you should drink more water, but they're not addressing the actual issue. So it's very difficult to understand who has these symptoms. Again, it's not that somebody who's listening to this who is feeling extremely thirsty doesn't mean you're diabetic. It's just that some people develop these things, and there is no hard and fast rule that you should develop all of these things. That's another very something that is very important, because as I told you, everybody's body is very different. Is your body handles glucose differently from my body, right? So whenever you're seeing a person with these kind of symptoms, you should look at it from the the holistic approaches, rather than just looking at the particular symptom and telling ki, you have diabetes. We have to treat you based on that. Well, of course, we do our blood test, but more importantly, we also look at these kind of symptoms if there are there. These are the earlier signs that people should understand as sort of orange flags to red flags that yes, there can be an underlying metabolic issue, be it diabetes or be it something else, and it requires an attention. I'll go and visit a doctor. I'll get my general check done, and I'll just see if there is anything.
So, like you mentioned, complications in neuropathy. These complications, can they reverse it? Let's say a person is having, or like he doesn't know that he has it, but since 5 years they are experiencing these type of symptoms, complications. So can they like reverse these symptoms?
There is no concept of diabetes reversal. That is why you need to understand that diabetes is a dynamic disease. It's a very, it's a disease which changes with time, with your efforts, with your lifestyle, with your genetics, with your place of living, so many things, with your stress, so many things. Okay. So again, 5 years is a very long term. If somebody is experiencing these symptoms for 5 years, it's possibly already too late that you have ignored it for a long time. So please go and check with your doctor and get it sorted as soon as possible. That is one thing. But if you look at the, let's say these symptoms have been there for the last 1 year, even until 1 year, 1.5 years, it's still something that can be, targeted in a better way. Okay. So if somebody has these kind of things, I would want them to go and first get their HbA1c checked. There is something called fasting blood sugar. There is something called postprandial blood sugar, which is basically you have your meal. From the first bite that you have had, wait for 2 hours, get your sugar checked again after the fasting is checked. And there's something called HbA1c. Okay, so what is HbA1c? It is the average of 3 months of sugar. This will classify whether that person is diabetic or not, or whether that person is pre-diabetic or not. See, for our intents and purposes, we are considering pre-diabetes and diabetes as same right now. Okay. Why is it important? Because anybody with pre-diabetes is more likely to develop diabetes if the situation is not handled in a better way. Okay, whatever lifestyle they have, they continue, then that is definitely going to develop into diabetes in near future or in far future. But it does happen for most of the people, 99% of the people. There are very few instances where people be in pre-diabetes itself for a longer duration for entire life. Okay, and even pre-diabetes itself has its own higher risks when it comes to mortality and morbidities and all of that. So how do you bring it back to its normal levels, near normal states? Okay. For that, you need to understand that I told you that, when your body is handling glucose, your muscles play the most important role. Okay, because your muscles are where some part of glucose is being stored, right? So when you do your exercise right, and when you get your diet right, okay, along with this, you need to also focus on other factors which could be contributing to this. What are the other factors? You're in constant stress all the time. Your body produces something called cortisol in higher quantities. Okay. Because of all of these, what happens? Your body is going into a more insulin resistant state. To break that cycle, you need to address those things as well, along with your diet and exercise. In exercise, there are two important components. One is your aerobic exercise, or one is your exercise which you call cardio, the cardio exercise. Cardio exercise is basically where your heart is being made to pump more blood, whether it is swimming, whether it is running, whether it is jumping, or whether it is your high intensity interval training. Whatever you do, wherever your body is consuming a lot of energy in beating the heart fast, those are called cardio exercises. That is one component. The other component is something called strength training. So strength training is where your body is building the muscle. Okay. So these things are the two important components in exercises. These contribute to improving your body's handling of glucose. And then because of that, your glucose will come back to normal levels. Okay. Once it comes back to normal levels, you wouldn't call it reversal of diabetes. You call it normalization of whatever your abnormal numbers were.
So, once again, diabetes is not actually going away. These are just the symptoms that we are trying to explain the reversal comes. So, you mentioned HbA1c, FPS, PLPS. So, these are these tests are sufficient, like enough to diagnose a person with diabetes.
Yeah, so that has clear guidelines. Okay, we have our, the diabetes associations across the globe. There are multiple diabetes associations for India, the International Diabetes Federation. You have your American Diabetes Association. They have all given guidelines. So we follow the guidelines. So when does somebody has what is normal temperature of the body? You tell it is 98.6 plus or minus 0.6, 0.2. Yeah, right. So similarly, you have certain cutoffs for when you call somebody diabetic, when you don't call somebody diabetic. And how are these cutoffs brought? For example, let me take the example and let me explain it to you. We have our ADA guidelines, okay, American Diabetes Association guidelines, where we classify someone as diabetic or not. Okay, we'll take the simple example of HbA1c. Okay, so if somebody's HbA1c is less than 5.7%, that means the person is non-diabetic. Somebody has it between 5.7 and 6.4, sorry, 6 and 6.3, it is pre-diabetic. If somebody is having 6.4 and above, it is diabetic. How did this thing come? They've followed millions of people. They've checked their HbA1cs, millions of people, not hundreds, not
You're
thousands,
right.
millions of people. They've checked their HbA1cs at multiple points. They have followed up with them, and they have categorized them into 3 points, where people with HbA1c of less than 5.7 live long, happily, and don't develop any complications relating to diabetes. People with 5.7 to 6.3 millions of people who have had these tend to develop diabetes and tend to develop complications related to diabetes. People with 6.4 and higher are at a very high risk for developing these complications because of diabetes. The classification is based on these kind of things. So we have clear cut guidelines as to when you call somebody diabetic or not. Whether you treat it or not is completely individual. That is different. So just because somebody is having an HbA1c of 6.4 doesn't mean you are going to treat that person with diabetes, bombard them with medications. That's not how it works. It's very highly individual, very highly focused that way. We call it tailored approach. This is about type 2 diabetes. In type 1 diabetes, the diagnosis is different, the approach is different, the complications are different, the prognosis is different. I'm not going into type 1 diabetes primarily because only 10% of the population have type 1 diabetes. The 90% or the bulk of the population of diabetes is your type 2 diabetes. If it is type 1 diabetes, it is a slightly serious diagnosis where you're going to sit with the patient and you're going to tell, okay, you're going to have this lifelong. It is a disease here at this point. No matter what you do, you will require one or the other support system, be it insulin, be it tablet, one or the other thing. You will be dependent on it. Your chances of developing complications are higher compared to type 2 diabetes or normal people, normal individuals, or when I say normal, I mean non-diabetic individuals. In type 2 diabetes, it is more like whenever you talk to a doctor, if somebody has type 2 diabetes, the first thing we tell is go do your exercise right, get your food right, then you are going to get good level of your HbA1c. Once your HbA1c comes to normal, it's good, you continue with that. If the HbA1c is not coming to normal, then we will think of your tablets. That's the approach.
So what are the existing treatment approaches for type 2 diabetes?
So what you need to understand, what we need to understand is the treatment aspect of it is very dynamic. That is one thing. The second thing is treatment is not exactly treatment when you look at it in the lifestyle approach way. So if you classify the treatment, that options that are available for people, you have what pharmacology is basically study of medicines. You have non-pharmacologic approaches, which is basically approaches or treatments or things that we use, interventions that we do, which do not involve any medication, whether it is injection or tablet. Okay. Then you have pharmacological approaches. Pharmacological approaches is where you are going to inject or you are going to take some tablet to help with your diabetes. Okay. So now, what are these pharmacological approaches? You've got certain medications, certain tablets, oral medications to help with that. You've got insulins to help with that. Correct? So these are primary things. There are various ways in which these things are delivered to the patient, whether it is tablets, for example, or whether it is injections that people take. There can be, you would have seen people with insulin, small vials of insulin. They withdraw the insulin and they take the injections. Then in other countries, it is much more commonly practiced where people have insulin pumps, where the body, where there's a pump that is attached basically to the body, and it's a very small device, by the way. It's not a big, huge pump. So you just attach it, and the body, the device itself detects the increase in the glucose and pumps insulin as and when required, okay, at the level that is required. It's again a very dynamic process that happens, a very brilliant technology. So these are the options available generally for people. But what is more important is your non-pharmacological approach, where your diet and lifestyle play the most important role. Even in medicines, if you want to look at it, there are multiple medicines. I mean, if I tell, most people wouldn't understand what those things are. There's something called sulfonylureas, there's something called meglitinides, there's something there's something called alpha glucosidase inhibitors, and then you have got insulins, you've got thiazolidinones. There are so many things. There are multiple tablets or multiple medical medications combinations which are used for different disease processes that happen within the body, and they'll help with your controlling the diabetes.
So, is like insulin is only reserved for type 1, or in type 2 also you give insulin and the other oral hypoglycemics together. How do you differentiate treating with insulin and the other oral hypoglycemics?
Again, quite a relevant thing, uh, because people think insulin is a death sentence, meaning once you take insulin, you're going to take it lifelong, right? That is not how it works. See, for type 1 diabetes, yes, people need insulin. That there ends the matter. That there is a line where you draw. Type 1 diabetics, eventually you are going to need insulin because your body is not producing insulin at all. There is no insulin at all. But type 2 diabetes, the disease process we have understood so far, there's a lot of other mechanisms which happen. See, in type 2 diabetes, we look at insulin as a sort of last resort. It's not exactly a last resort, but by the way, but it's a sort of last resort in your practical clinical experience. Okay, so you usually start with, as I told you, diet and exercise. So there's a general concept that HbA1c above 10, you will require insulin to treat the patient. Not necessarily. We've got hundreds of patients. I have personally treated hundreds of patients with HbA1c of 10 or above without taking insulin. Okay, they don't require insulin there. So insulin is given to people who have been on all the medications, who have done almost all the diet and exercises that they can do and that they can be on. When I say medications, they have been on all the medications doesn't mean they have been on all the medications that is available. They have been on all the medications that is suitable for them. That is important because it is tailored, of course, tailored approach. And then once all of these are burnt out, then if the sugars are still under extremely dangerous levels, where the HbA1c is not coming down to normal levels, or patient is developing complications because of this, that is where you go to insulin. In most of the cases, in certain people, there again, it's an approach which is highly individual. Meaning, I am trained in a different way. Some other doctor will be trained in a different way. The threshold for which they start the insulin is completely different. For me, I have a very laid back approach when it comes to insulin, because I don't start somebody on insulin right away for two reasons. One, people have that inertia in taking injecting themselves. It's a small, even though it's a very tiny needle, it's still a prick that happens. Even though we tell it it's like a mosquito bite, you will not feel a thing, you will still feel a mosquito bite. So similarly, insulin is also something that people will find difficult to take every day. So you start that only after doing a thorough counseling, that yes, you may have to take it, and it can be a long term thing also for you. Not that it's not a death sentence as such. It's not something that you're going to take it lifelong or anything, but there can be a possibility that you might take it for a longer duration. But we are also going to fix the other things, right? Okay, we're also going to push a little further. We'll see how it works and then we will see. Okay, so this is the kind of approach that I usually take, but that is where you are different. You That's where each doctor's approach is different. Some prefer going for insulin in a very very low threshold. Somebody has HbA1c of 10, you start insulin, and then after 3 months you're going to come back to the HbA1c again. If the numbers are good, you're going to slowly taper and stop the insulin and all of that. But then there are other doctors also who go more of with the medications, more of with diet and lifestyle, and then go to insulin. You switch that. That's highly individualized. This is how you start insulin. So if somebody is asking whether you start insulin for everyone, definitely not. And type 1, yes, of course you do, but type 2, you are going to use it in more of a later stages where you are not getting good control with your medications or your diet and lifestyle approaches.
So that is how the whole medication and lifestyle go hand in hand. And yeah, that's very important. And also last few years, like we've seen so many influencers talking about some medications like Ozempic and saying it, using it for weight loss, but these were actually developed for treating type 2 diabetes. So from a clinical perspective, what should these people know before they are starting this type of medication?
See,
Are they doing really
firstly,
wrong? Yeah.
okay, so if they are doing any wrong, and if you are addressing the influencers, I am definitely going to tell you that any influencer who is not qualified to talk about something should not talk about it. It's as simple as that. Okay. So if somebody is coming to you and telling you take Ozempic, this happens, you take Ozempic and that happens, I wouldn't, first of all, I wouldn't use the word Ozempic, because Ozempic, it's going to be a lawsuit for people who do that, because Ozempic is a commercial name. Yes, so it's very important for these so-called influencers who are talking without a qualification to talk about it, that they need to understand that it can be a potential lawsuit for them. Okay, it'll only work until somebody is not noticing about it. Okay, just because the guidelines are a little flexible in the country that they're doing it in, doesn't mean that they should do it that way. Okay, because only if they know, they should explain about it. Secondly, they should not use the word Ozempic. Okay, so it's a general advice. Ozempic is a commercial name. It's a very reputed brand, very reputed company which produces the molecule which they are calling as Ozempic. The molecule itself, or the chemical composition of it, is something called semaglutide. Okay, so that is something that people need to understand. Semaglutide and Ozempic have become interchangeable in our present because of the social media and other things. But semaglutide is what the composition is. Okay, so if you talk about semaglutide, it's a very beautiful drug. It's a very beautiful medication. Okay, so Semaglutide works because of various mechanisms. We'll not go into that. It's something called GLP-1 receptor agonist. Okay, that's what the class of medicine that comes with it. So it was primarily indicated for diabetes itself. Okay, semaglutide indication primarily was for diabetes. But when they did the studies, when they found that the people had so much of weight loss, there was a significant level of weight loss. That was when they realized that yes, there can be an indication for weight loss also. So if you ask me, is semaglutide indicated for weight loss? Yes, there is a formal indication. There is a clear indication that you can use it in people with certain levels or certain degrees of obesity, where semaglutide can be preferred as or can be the preferred medication of choice. Okay, so it is something that is used in day-to-day practice right now because of that. Okay, because there is a formal indication, there's a formal approval that you can use semaglutide for treating weight loss also. Okay, it's not only for diabetes right now. And the research, again, the research is also in a is progressing. We are finding out new things about it, new things about semaglutide, and most of them are good, by the way.
Yeah, I mean, when you see the same influencing thing, there's also a hype about metformin as an anti-aging medicine, pre-diabetic supplement, and there's also 30-day remission programs and Ayurvedic. There's so many influencers. They said they have cured diabetes. There's a lot of things happening around. I mean, what should patients, I mean, realistically rely on? Like you said, they are influenced by these influencers actually.
If you ask me what people should understand or what people should sort of when the entire conversation boils down to this, very simple, Dr. Kavya, that if somebody is diabetic or if somebody knows somebody who is diabetic, they need to understand that it's a very dynamic disease. It's a very dynamic disease process, we call it. It's not a disease, meaning it's not a diagnosis beyond which you are going to have lifelong like this. Okay, it's something going to be like this. It's a dynamic process that happens, first thing. Second thing, if somebody claims that they have cured diabetes, it's something that needs to be understood in a very different light. Okay, because words can be changed, words can be played with. Okay, you are taking metformin on your own, you don't even know what metformin is, you don't even know what PPAR gamma is, what PPAR alpha is, right? So if somebody knows this and then they are taking, yes, go ahead and do that. But if somebody does not know this and they are taking it on their own just because it is available, because influencers are telling it is anti-aging, it is pre-diabetes medicine and all of these, please don't do that. That is not going to do any good to you. It can even do a lot of harm. Okay, the best thing, if you are taking a medicine, the best thing it can do is do nothing. Meaning, if it is not doing anything, be lucky and be happy that you are lucky that it is not doing anything. Because if it starts doing its work, its negative impact, you won't be able to bring it back to normal levels, bring it back to normal state back again. Okay, so we have seen people develop severe allergic responses because of metformin. We have seen people develop their people, have their gut health changed entirely because of metformin being taken by themselves. They come and tell, I went to the medical shop and they gave me this and I started taking it. So don't do that, is what I'm telling. So these are the two important things that people need to understand. One is diabetes is a dynamic disease that they should, have a proper approach for. And second thing is, I mean, it's there's no cure as such. If somebody claims cure, please take it with a pinch of salt. And second thing, please don't medicate on your own. Don't self-medicate. That's not how it works.
Well, there's also a lot about diet, like remedies. Like they just simply replace sugar with jaggery and bitter gourd juice. There's a lot of things that is happening. So, I mean, these things can they really help manage diabetes, or is it just a myth?
That's also a very brilliant question, which is quite a common thing that I have seen my patients talk about. I'll give you an example, right? So I have patients come up and tell, doctor, I have ever since I got diabetes, I've quit sugar. I don't take sugar at all. I just use jaggery. I don't use anything else. See, that's why I always go to what is the disease process, so you understand what the disease process is, and it's easier for you to understand what you do for it. Okay. So when you look at the example of diabetes itself, you need to understand that when you have glucose load within the body, that is when you are going to see the effects of diabetes, correct? So basically, if you boil down the non-pharmacological approach, you tell lower the glucose levels within the blood, as simple as that, right? So how do you lower it? You need to understand that the source you are having should not have that much of glucose. For example, if you are having jaggery, you need to understand jaggery is coming from sugarcane itself. Sugar is coming from sugarcane itself. It's a basic concept. You have jaggery in the mouth, it gives you the same sweet sensation that sugar gives. So sugar, jaggery, and for that matter, even honey is equally bad when it comes to diabetes in people who are having uncontrolled diabetes. Again, it's again I want people to understand that once somebody is having formal diagnosis of diabetes, it doesn't mean that they stop having sugar altogether. It is good if they stop having altogether because of other reasons, not by force, not that they should come and they should think voluntarily that I should never have sugar. This is how my life is going to be. That is not how it works. So that is one thing. The second thing that I've seen people commonly talk about is when you have sugar, you don't eat rice. Most of the people I tell, whenever patients come, I tell you eat rice, there's no problem, but you need to have it in proper quantities that you need to have it in. If you're having two big bowls of rice every single day and expecting your sugar is not coming under control, it's not going to happen. That doesn't mean you have to go to the other extreme also where you stop eating food altogether, going on intermittent fasting and other things. That is also going to harm your body. There needs to be a balance there. Second thing, when it comes to rice particularly, why rice important? Because we in South India, where I practice, we have seen, it's more of a rice dependent. Rice is the staple in South India, at least for the most part, right? Correct. So people need to understand that rice doesn't mean it's just the rice that is coming out of your cooker. Okay. So even your idli, dosa, poha, even the bel puri contains rice, right? So people always miss those things. That's why I do something called 24-hour recall. So somebody tells I don't have rice at all. I'll be like, okay, please tell me what you had for breakfast. Doctor, I just had five idlis. Yeah. And what did you have for lunch? Doctor, nothing. I just had two dosas. See, you're having rice again there, right? You're not just having the plain boiled rice, you're just exactly having it in a different form. So those things need to be addressed. And sometimes it becomes difficult for doctors to address these things because at one point you are treating the patient and you're not able to give enough time because of various reasons. You will have multiple patients stacked up, you'll have multiple appointments, you can't give each individual that much time to come and explain to them what these things are. So you need to understand that when it comes to the diet part, please visit or please consult a dietitian, a qualified dietitian or a nutritionist who is going to break down everything for you in depth. They are qualified in that. Okay, so take their advice and do that. So sugar should be reduced certainly. And people also assume that taking things like alternate sugar alternatives such as your sucralose, your aspartame, things like this, and assume that they are bad. Okay, they're not bad. They're definitely something that is proven beyond doubt that they are really good alternatives to sugar. Okay, now we have got something called monk fruit, and we've also got stevia, right? So stevia is also a good one. So there are multiple, yes, so there are multiple, yeah, that's basically it. So there are various names for various sugar alternatives, but that's what it is. So you have got multiple sugar alternatives also, and if you don't know about it, approach a physician or approach an expert, and then they'll be able to help you. So that is what is important about jaggery and sugar. So people need to understand that they need to cut it down. If especially the sugars are not under control, I would recommend making it zero on a temporary basis. Once your sugars come to normal levels, then you can slowly put your once your glucose come to normal level, then you can probably slowly put your sugar back to your life in moderation, of course, in very small quantities. You don't have to hurt yourself by or by thinking that I'm never going to have sugar back again in my life.
Okay, so that's it for the diet. And we see the new treatments and the research in diabetes. Well, can you just tell our viewers and me what is the recent update on the diabetes management?
We do see a lot of research happening within diabetes also. Okay, so as we have seen, there is your the semaglutide, or as you call it, Ozempic. In the Ozempic is the molecule produced by Novo Nordisk, right? So that you have something called tirzepatide. Okay, tirzepatide is something that has come. Tirzepatide nobody would have heard, very less people would have heard. You would have heard the influencer selling the word Monjaro. Okay, so that is what is the tirzepatide. So these have come to the Indian market. Again, these have come to Indian market recently. They have been in studies for a long time. They've gone off patent, so they've been in the studies for 20 years or so. So don't think semaglutide is a very new molecule which has come, so people don't know about it. They know extensively about it. That is why it is approved by FDA, right? So if you leave those two, there are other ones which have come. Okay, there is something called retatrutide. Okay, there's something called cagri-sema, which is combination of two different molecules. Semaglutide is one of it. There's another amylin analog, as we call it. That's again a different mechanism. So there are multiple molecules like this which have come, which are focused more on diabetes and weight loss, because diabetes and weight loss go hand in hand, particularly in Indian population at least. Okay, So I've told you this. Then there is your weekly insulin, which has come, which is still in in the research phases right now. It's almost in the final stages of research, where you take insulin on one day. You don't have to worry about taking insulin for one full week. Then you've got nasal insulin, okay, where you spray where you use a nasal spray to deliver the insulin rather than using an injection. That is going to be a game changer when it comes, because if at all, if it comes to India, because for people who find pricking themselves, something that they can't do on a daily basis, the weekly insulin is going to be extremely good, and the nasal insulin is also going to work wonders in controlling diabetes. Again, at the end of the day, it's the patient who is benefited. It's somebody, if you are reducing the risk of somebody developing heart attack, that is where your happiness lies. So you're going to treat the patient more with the nasal spray of the nasal form of insulin, the weekly forms of insulin, and these. Apart from this, there are other certain the oral medications, rather we call it, which are also in studies, but they're also all in phase 1 or phase 2 trials, where they're still in a lot of under a lot of scrutiny as to what side effects they have and all of those. So that's definitely something that is coming up shortly. So if you look at it, if you list down the most important ones, if you look at it from the clinical standpoint, then your cagri-sema, retatrutide are one of the important ones, and you also have your weekly insulin, as I told. They call it icodec, if I'm not wrong, and they also there's also your nasal insulin, and then there are certain other molecules, there are certain other oral medications which have come for in the research, in the field of research. But not only that, even in management of diabetes, people are now understanding that the diets also play a very important role. So there are a lot of research that is coming for the different types of diets causing different impacts, having different impacts on diabetes and the associated conditions around diabetes also. Then you also have various guidelines which are coming up for exercise recommendations. Now, for example, we have a clear recommendation for exercise. If you ask what is the bare minimum exercise that somebody has to do, there is clear guidelines. The guidelines are very simple. It's either 30 minutes of moderate intensity activity like brisk walking, okay, for 5 times a week, amounting to 150 minutes a week. Okay, this is one thing. Plus 2 days of strength training. This is there. Or you do 15 minutes of high intensity activity per day, amounting to 75 minutes per week, plus 2 days of strength training. This is standard guideline, meaning this is the bare minimum that you should do. So if somebody is asking whether I should do this much, that is there. Another important thing that I want people to understand, that people miss, is people come and tell, doctor, I walk around the entire day in my house, I walk around entire day in my work. See, your exercise is a dedicated time, right? So even if you walk around 10 kilometers a day, please have a dedicated time for exercise, where you're focusing only on exercise, not focusing on what your boss tells if you don't do this job. So you need to focus on exercise and think of it as a independent or unrelated to other things kind of time of your day. So focus on that and do it. That is when it is going to be an impactful thing.
So these diet and exercise patterns is just for the management, or can we consider them in preventing diabetes?
When it comes to preventing diabetes, exercise and diet play the most important role. If you boil down the exercise and diet, as I told you, one is your aerobic exercise, or one is your cardio exercise, as you call it. The second is your strength training. When it comes to diet, I'm going to boil it down to two, three important things. One is increase your protein intake in the diet, reduce your simple carbohydrate intake, and third, increase your complex carbohydrate intake. Okay. When I say complex carbohydrate, it also includes fiber. Increase your fiber intake. Okay. Again, you need to visit a expert in who can help you in all of these things, because we've got chat gpt and so many other things helping in all of these right now, but I wouldn't recommend going for all of those, because they have their own dangerous aspects of them. So because certain people have certain gut health issues and they can't take certain food, so it's better if they visit an expert for this. But if you generalize this is how it is. Second thing, if you look at the diet that people follow in the western countries, there is a little bit of truth to why people develop diabetes late in their life. Okay, that's what the first initial questions were here also, right? So we focus more on having low processing of foods. What is processing of food? Processing of food is basically an action that is done for the food, which will make it easier for your body to digest. Okay, so we have ultra processed foods, we have processed foods, and then we have no processing within the foods, like unprocessed foods. What are unprocessed foods? Unprocessed foods are your raw vegetables. Raw vegetables. You have a salad. You have just you take the vegetables from the farm. You wash it. You take the vegetables from the shop, wash it, and then cut it, and then put some salt if you want on it, pepper on it, and then eat it. Those are your unprocessed foods. There is no processing that is happening. All the process will happen within the body, meaning the body has to take in everything. It is raw material you're giving. The body has to break it down. Body has to digest it. Body has to absorb it. Right? That is unprocessed food. Then you have semi-processed foods. Semi-processed foods are where you are going to have a little bit of processing that is done in that already, and then you are going to utilize your cooking methods to process it a little more. Okay. Or let's say, for example, you have boiled vegetables. Okay, you make a soup out of it at home, not the outside packed soup that you have. You make chapati and curry, for example. So those are your semi-processed foods. You are processing a little, you are cooking it a little so that your body finds it easy to digest. Can you have atta by itself? You can. It can cause a little bit of stomach pain sometimes. It is your unprocessed food. But when you make it into a small ball, then you roll it and then you bake it and then you eat the chapatis or rotis. It is easier for your body to digest. It is even tasty for you, right? Then you have ultra processed foods, processed and ultra processed foods. These are the foods that have extremely high content of calories within them and very easy for your body to digest. I'll give you an example. Very sugary drink, very sugary beverages. You take the very sugary beverages. We call them liquid calories, by the way. So, what are liquid calories? These are the ones that people ignore. People tell I have this much rice, but then they'll have 2 3 glasses of some processed, ultra processed. I don't take the commercial names there, but some ultra processed sugary drinks, and then they expect their sugar to be normal. That's not how it works. That's not how your body works, right? Those are the calories which people are discounting for. People are disregarding. People are not counting those. Okay. And then you also have certain ultra processed foods like your deep fried items, like your chips that you take, the ones that are processed extremely. You have it, you can't stop it. So again, very simple things, very simple. See, how do you know if something is processed or not? L- Internalize. You see, you assess it. If you have something, if you like it too much, it is probably ultra processed. As simple as that. Your body wants to go to the easiest path. If you leave your body alone, it is going to go and sleep somewhere, right? Again, if you're liking salad, it's a good thing. Don't stop having salads. But if you are liking these chips and sugary drinks, then definitely that is something that you need to reconsider, and that is something that you need to assess about yourself, that you are consuming a lot of calories which are not counted for, and these calories are not the healthy calories that you are having. Healthy is the key word there. So if you are having something that is wholesome, grains, a lot of grains, a lot of vegetables, a lot of good sources of meat, these are your healthy sources of food which should be focused on, which are going to help you in preventing diabetes and your metabolic conditions in the longer run.
That's a lot of good information. Thanks a lot for all the information on detecting, managing, and prevention. Now looking out for the complications. I'm sure our viewers will enjoy this episode. Thanks a lot for your time on Sunday. Thank you.
Thank you, Dr. Kavya. Thank you for giving me the opportunity to talk to people and also break down certain myths that people have, especially because of all the social media, the overwhelming things on social media. Thank you for having me here.